Okay, hi, my name's Denise. We are going to be doing a skull series, and that consists of a lateral, an SMB, a Towns, and a Caldwell. And I'm going to begin by setting up our room. So we're going to come here to the tube and we're going to detent this to 40 inches. So we detented it to 40 inches. And now we're going to make sure that we have our IR, and then that we have our shield, and then we have our stool for the patient right there. So now that we have everything ready, we are going to go and get our patient. Okay, now that our room is all set up, we are ready to look at the patient.
Yes.
Hello.
Hi.
My name's Denise. I'm from the radiology department, and I'm going to be taking some x-rays of your skull.
Okay.
So may I have your first and last name?
It's Sylvia Salazar,
And your date of birth?
10/27/84.
Awesome. And is there any possibility of being pregnant?
No.
Okay. And what brings you in today?
I was playing basketball and I got hit in the head with an elbow.
Oh, I'm sorry. Okay, perfect. And you don't need to take anything off, but I do need you to take anything if you have earrings on, if you have a hearing aid, any dentures, any bobby pins, clips, or any facial jewelry. If there's a little metal thing in your scrunchie, I would need you to take that off for me before we begin, okay?
Okay.
Okay, perfect.
Thank you.
Okay, so now we are ready to shoot our first projection, which is the lateral projection. And we're gonna start by our tube being detented to 40 inches, and we have our 10x12 cassette. So we see that it is 10x12, and it is crosswise for this projection. Our central ray enters perpendicular and enters 2 inches superior to the EAM. So here is our EAM, and it is 2 inches superior to that. And the MSP is parallel to the plane of the IR, and we can see that our MSP, it is parallel to the IR, and our interpupillary line is perpendicular to the IR, and our IOML is perpendicular to the front edge of the IR. So we can see that it is perpendicular to the front edge of our IR. And now we are ready to shoot the image once I put my left marker right over here. Okay, I have my patient shielded, and now we are ready to shoot the image. And our technique that we are going to use, it's going to be 85 at 628 mass. Okay, so hold still. Okay, I'm going to shoot the image, so hold your breath. Beep. Okay, and you can breathe and relax. Perfect. And now we are going to shoot our next image. Okay, so now we're going to shoot our AP axial projection Towns method. So we have our cassette. It is a 10x12 and it's lengthwise. So we have it right here, 10x12 lengthwise. We have our SID 40 inches. That is detented. And then our central ray enters 2.5 inches above the glabella, and it passes through the level of the EAM directed through the foramen magnum at a caudal angle of 30 degrees to the OML. So we have our tube that it is at 30 degrees. We have our central ray 2 inches above the glabella, and the OML, it is perpendicular to the IR, as you can see that. And then we have our patient shielded, and then our technique that we're going to use, it is 85 at 14 through 16 mass. So now we're going to ask the patient not to move, so please hold your breath. Okay, beep. Okay, and now you can breathe and relax. Okay, perfect. And now we're going to move on to our next image. Okay, now we're going to do our next projection, which is the PA axial Caldwell method. And we're using a 10x12 lengthwise cassette. So we can see that we collimated to a 10x12 and it's lengthwise. The position for the patient is with the forehead and nose touching the IR. And our MSP and OML are perpendicular to the IR. Our central ray exits at the nasion, and we see that we have a 15-degree cauded angle. So That's for the central ray. We see right here it's going to exit at the nasion with a 15-degree cotted angle. And our technique that we are going to use is 85 kVp at 14 to 16 mass. And I'm going to put my right marker here on the right side. And we shielded our patient, and now we are ready to shoot our x-ray. Okay, please take a big breath and don't move. Beep, x-ray. Okay, you can breathe and relax. And now we are ready to shoot our next image. Okay, now we're going to be shooting our last projection. It is the SMB Schuler method. We're going to use a 10 by 12 cassette. It's going to be lengthwise. We're going to be detented at 40 SID. The MSP is centered perpendicular to the IR, and the IOML is parallel to the IR. And now we're going to position our patient and shoot the x-ray. Okay, now we're going to shoot our last projection, which is our SMB Schuler's method. And we have the central ray. It enters between the angles of the mandible, and it passes through a 0.34 superior to the EAM. Our technique that we are going to use is 85 kVp at 28 to 32 mass. We're going to use our right marker right here, and we have our patient shielded, and we have our patient positions. So now I'm going to have you hold your breath. Okay, x-ray, beep. Okay, you can breathe and relax, and now we are all done. Now that we are done shooting our 4 projections of the skull, we are ready to evaluate the images and make sure that they are of appropriate quality. This is our lateral projection of the skull, and the evaluation criteria is evidence of proper collimation, entire cranium without rotation or tilt demonstrated by superimposed orbital roofs and greater wings of the sphenoid, superimposed mastoid regions and EAM, superimposed TMJs, and sella turcica in profile, penetration of parietal region, and no overlap of the cervical spine by the mandible. This is our PA axial Caldwell method projection of the skull. The evaluation criteria is evidence of proper collimation, entire cranium without rotation or tilt demonstrated by equal distances from lateral borders of the skull to lateral borders of the orbits on both sides, symmetric petrous ridges, and the MSB cranium aligned with the axis of the collimated field. The PA axial Caldwell demonstrates petrous pyramids lying in the lower third of the orbits. The entire cranial perimeter showing 3 distinct tables of the squamous bone, and the penetration of the frontal bone with appropriate brightness at lateral borders of the skull. This is our AP axial projection Townes method of the skull. The evaluation criteria is evidence of proper collimation, entire cranium without rotation or tilt demonstrated by equal distances from the lateral borders of the skull to the lateral margins of the foramen, the magnum on both sides, symmetric petrous pyramids, MSB of cranium aligned with long axis of the collimated field, dorsum sella and posterior clinoid processes visible within the foramen magnum, and the penetration of the occipital bone with appropriate brightness at lateral borders of the skull. This is our SNV Schuler method projection of the skull. The evaluation criteria is evidence of proper collimation, entire cranium without rotation or tilt demonstrated by equal distances from the lateral borders of the skull to the mandibular condyles on both sides, symmetric petrossae. The IOML is parallel to the IR, demonstrated by mental protuberance superimposed over anterior frontal bone, and the mandibular condyles anterior to the petrossae, and the brightness and contrast sufficient to demonstrate cranial bone anatomy.